Welcome to BLR training. Everyone gets nervous or anxious from time to time. But for some people, that anxious feeling is magnified and sometimes doesn't go away. This syndrome, referred to as generalized anxiety disorder, is a serious illness and can sometimes hamper daily life and work. As a supervisor, you may be faced with employees who have GAD. This training will help familiarize you with GAD and what you can do to help. Be sure to ask your supervisor or trainer if you do not understand any of the information presented in the program.
Hi, I'm Laura Piper, licensed clinical social worker. Every day I work with all types of people, many of whom struggle with mental health issues in the workplace. During this training, I'll be talking about ways you as a supervisor can help your employees who may have mental illness. The main objective of this particular session is to help you understand what generalized anxiety disorder is and how you can help employees who are dealing with it. By the end of the session, you will be able to understand generalized anxiety disorder, know the causes and symptoms, understand how it can affect work, know what the law says, and learn how to handle employees with generalized anxiety disorder.
Before we begin the session, let's take a few minutes to see how much you already know about GAD. When you're ready to begin, select Next. Select True or False, then Submit.
Everyone experiences anxiety from time to time, whether it's about paying bills, an important business meeting, or even driving in traffic. Different things trigger anxiety in different people, and it's completely normal to experience anxiety from time to time. But when anxiety becomes an everyday event, or it happens when there is nothing stressful precipitating the anxiety, it can be a problem. GAD is one of the many anxiety-related disorders, and it's more common than you might think. Overall, 40 million people are affected by all kinds of anxiety disorders, making them the most prevalent mental illness in the United States. The cost associated with anxiety disorders is more than $42 billion per year. That's 1/3 of the country's mental health bill. And most importantly, anxiety disorders are highly treatable. Yet only about 1/3 of anxiety sufferers receive treatment. Let's hear now from Laura Piper.
Generalized anxiety disorder is a neurological anxiety disorder that is characterized by uncontrollable and sometimes irrational worry. It may come on when a person feels he has no control of what is going on around him. It is the most common cause of disability in the workplace, with 6.8 million people having the diagnosis.
Let's look at the causes and symptoms of GAD. Select each tab to learn more. What are the symptoms of GAD? People with GAD may suffer physical symptoms like pain, headaches, nausea and diarrhea, and trembling or twitching. What causes it? Experts aren't completely sure what causes it, but they think it is due to a number of reasons, like your genes, environmental or physiological factors, and brain chemicals. Who gets it? Anyone can get GAD, even kids, but it usually progresses slowly. Women are twice as likely to have GAD than men. Anxiety comes in many forms. You should know that GAD is only one of the many anxiety disorders, including panic disorder and phobias. This training session will focus on the most common type of anxiety disorder, GAD. The main symptom of GAD is a constant and exaggerated feeling of worry. Some people describe it as not able to turn off worrying. The tension may be caused by things that should not create that much worry or that are not grounded in reality at all. The constant anxiety can lead to insomnia, difficulty concentrating, and/or irritability. At work, an employee might find it difficult to carry out certain tasks or difficult to come to work at all, causing missed workdays and lower productivity.
As we discussed earlier, only about a third of people who suffer from GAD actually get treated. Some may think there is no treatment available. Some may be embarrassed to tell anyone that they suffer from GAD. And some try to self-treat with drugs or alcohol, which may lead to a cycle of substance abuse. It's important to encourage employees who suffer from GAD to seek the advice of a medical professional. There are many options for treatment, such as talk therapy, including cognitive behavioral therapy, relaxation techniques such as yoga or deep breathing, and medication therapy. Only a medical professional can determine which treatment is right for each patient. Now let's check in with our expert to hear about how you can use your company's Employee Assistance Program, or EAP.
If your company has an EAP program, you can refer employees to therapists who specialize in cognitive behavioral therapy, which is the therapy of choice for generalized anxiety disorder.
Now, it's time to see how much you are learning from the information presented so far. When you're ready to begin, select Next. Select the correct option, then Submit. Now, it's time to ask yourself if you understand the information presented so far. For example, do you understand what we've said about what GAD is, how it affects the workplace, the causes and symptoms, and treatment options? It is important that you remember this information after the course is complete. Do you need to go back and review? Next, we'll take a look at what the law says and steps you should take if one of your employees is dealing with GAD.
Now let's turn our focus to your legal responsibilities when dealing with employees or applicants with GAD. Select each tab to learn more. GAD and other anxiety disorders may or may not be covered under the federal ADA. The ADA does not contain a list of medical conditions that constitute disabilities. Instead, it has a general definition of disability that each person must meet. Therefore, some people with anxiety disorders will have a disability under the ADA, and some will not. Under the Act, a disability is defined as a physical or mental impairment that substantially limits one or more major life activities. An employee must provide a record of the impairment. You can request documentation from a healthcare provider that describes how the medical condition limits the employee's ability to perform job duties and suggests reasonable accommodations, which we'll discuss next. If your employee has a GAD that is covered under the ADA, you will need to work with the employee to determine how to best accommodate the illness. Some examples of reasonable accommodation for employees with GAD are rotating work schedules, reassignment of duties, reassignment to a vacant position, and permitting accrued paid or unpaid leave time for the employee to get effective treatment for the illness. Let's check in with our expert about just how certain accommodations can help employees with GAD.
As a supervisor, you can be sensitive to your anxious employees by providing detailed job descriptions and allowing employees input on how their job is performed. Keeping lines of communication open so the employee feels free to let you know when anxiety is becoming an issue is another strategy.
The Family and Medical Leave Act, or FMLA, is another option for employees suffering from GAD. This law allows certain employees who meet eligibility requirements to take up to 12 weeks of unpaid time off from work while still maintaining their workplace benefits. This law has many eligibility requirements, and also some states have different requirements. You must fully understand the full scope of your state's FMLA laws before granting any leave. In general, employees may request leave to care for their own serious health condition. Leave may be intermittent if both you and the employee agree. You may require the employee to provide medical certification. The FMLA provides a general definition of serious health condition that includes chronic conditions, conditions requiring multiple treatments, and conditions necessitating 3 or more days of missed work. This may include GAD. If an employee comes to you with a complaint of GAD, or perhaps you simply notice an employee might be feeling more anxiety than is appropriate, what should you do? The answer may be different in each case, depending on the severity and how work is being affected. Select each tab to learn more. Ask how work is being impacted. Your first step is finding out how GAD is affecting the employee's work. Are there certain job duties that cannot be performed? Is the employee able to concentrate on tasks? Think of accommodations that might help. Would a flexible work schedule help? A shift change? Maybe a reassignment of duties, or even a complete job change? There may be some simple steps you can take that could help the employee's limitations at work. Follow up. If an accommodation is provided, follow up with the employee to make sure it is effective. You may also want to recommend your company's EAP, if there's one available. Applicants may have questions about whether and when they must disclose a disability, such as GAD, to their potential employer. They may have concerns about negative consequences that may prevent them from getting a job. As an employer, you may not ask questions on a job application about the history or treatment of mental illness, hospitalization, or the existence of mental or emotional illness or psychiatric disability. 2 exceptions include if an applicant asks for reasonable accommodation for the hiring process, and if you believe before making a job offer that the applicant will need accommodation to perform the functions of the job.
Now it's time to see how much you've learned about dealing with GAD in the workplace. When you're ready to begin, select Next. Select True or False, then Submit. Let's take a moment now to make sure you understand the information presented during this training session. Do you understand what we've said about what GAD is, how GAD can have a big impact in the workplace, the causes, symptoms, and treatments for GAD, what the law says about GAD, and what you should do if one of your employees or an applicant has GAD? It's important to understand all this information so that you can effectively manage employees who are dealing with GAD. Let's now finish up with some key points to remember. The key points to remember about this training session are GAD is a serious and widespread illness. GAD can have a big impact on workplace productivity. GAD may be covered under the ADA and FMLA. You need to know what to do if an employee has GAD. This concludes the training session on generalized anxiety disorder. Please be sure to go back and review any information that is not completely clear.